So now the next is the investigation for malnutrition. What are the investigations that you have to do in cases of malnutrition? Now, in cases of malnutrition, you should do different types of investigations. Now, you need to know that what the investigations in malnutrition, you first start by investigating the disease, then you investigate the cause, then you investigate the complication, then you investigate the background. But malnutrition does not have any background, and those are the different things. And then you can investigate for the prognosis. There is no investigation also for the prognosis. Generally, how do you investigate for malnutrition? How do you make a diagnosis of malnutrition? Malnutrition diagnosis is clinical based on the mid-upper arm circumference and the scores. That is a Z-score. You have the Z-score and you have the WHO score. Is it clear? So based on those scores, you can just make a diagnosis of undernutrition and malnutrition and the severities coming with it. Now, after having all that on malnutrition, you now want to speak about the etiology of the malnutrition. For the etiology of malnutrition, we are speaking about different elements. In the case of protein energy malnutrition, the etiology, there is no investigation that is done for protein energy intake. Is it clear? When there is low level of protein energy intake, there is no energy etiology that is being given for that. It's only taken from the nutritional history. Now, the next one is the parasite. So visualize if there is any parasite, ask for stool to support. You ask for stool antigen, and to confirm, you can ask for, with a gastroenteritis, you can ask for a stool culture. For acute infection, like acute bacterial infection, you have to investigate for the point of focus. If there is pneumonia, you support with a chest X-ray and you confirm with a sputum analysis. Is it clear? With sputum analysis with microscopy. You do, if it's acute viral infection with measles, is it clear? Generally, you can just take a swab for the upper respiratory tract when there is a coryza, and then you visualize if there is any. You take the swab and visualize if there is any PCR for the microorganism, or you can do also support with the antibodies. Is it clear? Support with the antibodies of that. And in case of measles, when there's already the exanthem phase, you can also do a skin swab and then you visualize the PCR. Is it clear? Now, for the malignancies, you need to know peculiar malignancy and then the investigation. The local investigation for malignancies that you need to first do, you need to do a biopsy and histopathology. That's the local investigation. And then for the systemic, we have other supportive investigation for the systemic, like in the case of biomarkers that you have to take in consideration. And you have to also take in consideration if there is any spread, you do for a CT scan for the spread. Is it clear? And the best to confirm the systemic spread is going to be a positron emission tomography. Is it clear? So those are the different elements. Now for chronic, the protein energy intake is a similar aspect on the you have to still consider your nutritional issue. The parasite, you also ask for stool antigen for the stool analysis to visualize if there is any going to be cyst of the worms, any egg of the worms, or any worm, adult worm that is going to be visualized. For tuberculosis, you do sputum analysis with acid-fast bacilli, for with the senescence stain to visualize acid-fast bacilli. You do culture and sensitivity with Lewis-Jensen, and then to support, you can do the MAN2 test. Is it clear? That is going to be, or the tuberculin skin test. For the viral, you just do the serology, supportive serology with for the serology of HIV to visualize if there is any antibody of HIV, and to confirm the HIV, you now do what? You now do the ELISA, or we do another test that I've just forgotten the name, but I'm just going to give you that in the summaries. The test starting with W, so I'm just going to give you that later. Then the next one, you have malignancy. You have to still use the same protocol as you did here. So that is how you evaluate for the etiology. Now the next thing is to evaluate for the complication. To evaluate for the complication, there are vitamin deficiency complications that are clinical evaluation. But now we have other evaluations like hypothermia, which is clinical sign. Hypoglycemia, you use the random blood sugar to find if there's any hypoglycemia. Dehydration, you can visualize the urea creatinine ratio that is going to be greater than 20, or you visualize the hematocrit that's going to be they are going to have hemo concentration greater than 55% hematocrit. You are going to, if you want to know mineral deficiency or electrolyte imbalance, ask for a complete blood ionogram for sodium, potassium, chloride, calcium, magnesium, and all that. You also ask for the serum iron in cases of iron deficiency for supplementation. We have the other ones, vitamin deficiency, you can ask for the serum vitamin level. We have the infection. For the infections, you need to know that one. You can also ask for the CRP, the PCR, the CRP, and the full blood count to visualize if there is any sign of infection. Also, on the full blood count, you can know for the hemoglobin level to find if there's any anemia. On the full blood count, and you can know the thrombocyte level to find if there's any thrombocytopenia. And also ask for a prothrombin time, a partial thromboplastin time to evaluate, or international normalization ratio, that's the clotting profile, to evaluate if there is any problem with the bleeding. Now, those are the different investigations that you have to do. After doing the investigation for the malnutrition, we need now to treat malnutrition.